Hi, everyone. Very excited to introduce our next speaker, Dr. David Dornfeld. We're going to be talking today about how hyperbaric therapies and safe detoxification can reduce the symptoms of autism. Before we get started, Dr. Dornfeld, I love the people watching right now to get a little bit more idea about who you are and why you're so passionate about what you do.
Well, thank you so much for this kind of interview, and I have an opportunity to share some of the knowledge. I've been doing integrative medicine for 31 years now, and I got involved with taking care of autistic kids because I learned from my years of ACAM, that's the American College for the Advancement of Medicine, that we treat people holistically and try to help people heal from within. And by learning about how to take care of the human frame, we learn how to take care of diet, exercise, how the environment plays a big role. And I really got involved with environmental medicine after going to my first autism conference, which was back in 2005 when I went to Dan in Washington, D.C. And I sat in the first lecture, and there was a shot in the dark by Betty Lowe Fisher, and she talked about how her son had vaccine injury. And the next lecture was done by Stephanie Cave, and she talked about a safe vaccination schedule. And then we had like a 10-minute pause between patients, between the lecturers, and the woman next to me had a parent badge on, and I had a doctor badge on. And we got a little discussion going on, and I asked her how her kids were and what was going on. And then she said, "How are my children?" I said, "Well, I don't have any children." And she says, "Well, why are you here?" I said, "I guess I'm here to learn how to take care of people like you." And it just turned into a snowballing effect on taking care of people who have diseases, not the diseases the person has. And that's always been my philosophy of life. You know, Kenny Bach was telling me for years, you got to learn how to take care of autistic kids. You know how to take care of detoxification and thyroid balancing, but you really want to put your heart and soul into taking care of these kids. And I really didn't want to do that initially because I didn't know anybody with autism. I don't have any children on the spectrum. And I said, let me go and learn about it. And then I got involved with learning about that aspect of autism care. And then I learned about how we can unwind things with hyperbarics. And then I continued my realm of training through being an ILADS doc, taking care of Lyme disease. And as an ACAM chelating specialist, been certified a couple times. We find a way of unwinding people through various modalities. I'm going to try to share that with you today on some of my tools that I use. And as you know, as dealing with autism, you have a piece of the puzzle you have to unwind every single day. So you want to figure out how to balance the person. I'm going to try to take you on my approach to unwinding people and what the important items are that have to be looked at. I add MAPS, which is a great training session now. We have meetings twice a year where doctors come from around the world, and I'm the moderator for the environmental medicine section. So they feel I must have an understanding of what's going on. So when we talk about environmental toxins and how it plays a big role, I really think that's a huge impact. So I'd like to begin my lecture whenever you're ready, or discussion, and then we can have some question and answers at the end because I have a lot of information to try to get out for you.
Perfect. Yeah, I think everybody would be really excited, and this is a topic that many of us need to learn more about. So dive in whenever you're ready.
Well, as you can imagine, with the environment around us playing a big role, we want to think about what our goals of life are. And every one of my topics that I always talk about, this is my opening slide, which really is my heart and soul. We really try to keep our diet and environment as toxin-free as possible in order to promote the quality of life and prevent disease. If we had a beautiful air around us like that picture and we didn't have to worry about pollution, life would be really good. But unfortunately, that's not always the case. In case anybody wants to get a hold of me, my email is listed there. It's drdavdornfeld@gmail.com. And my website is familywellnesscenternj.com. And so I'm hoping that we can work about these avenues on using hyperbaric safely and detoxification safely in reducing our problems with autism. When we look at how we look at any disease state, from autism to aging, you have to think about what is controlling the human frame. And the microbiome, as you know, is so paramount important. It controls 80% of our immune system. And if you can take care of your food allergens, you can avoid toxins and GMOs, then life gets a lot stronger for you. You have to think about taking care of all the different systems in the body. Gastrointestinal, sex drive, and thyroid balance is so important. Traditional doctors just look at T3s two T4s and TSHs. And they don't look at T3, the active ingredient in thyroid function. So if you have to think outside the box in order to make these changes. And I find enhancement of circulation and reduction of nerve inflammation markedly reduces the disease state and improves tissue healing, brain processing, and reduction of ADHD. And through diet and detoxification, especially with safe chelation therapy, we compound that with nutrition and hyperbaric therapies, and the immune system markedly improves. It would be wonderful if we could be just like this hawksbill turtle and going to a cleaning station. I go scuba diving. I'm actually a diving medicine certified physician, and we learn how we work with hyperbarics in that era of my life. But if you were, let's say, taking your child to a cleaning station to get the physical therapist and the occupational therapist and the ABA therapist and the speech therapist to work in synergy and synchronicity to try to improve the problems of taking the parasites and the pesticides and the chemicals off of you, that would be a great place. It would be great if we could take our kid to a cleaning station to unwind everything. Just to let you know, this one over here is called the doctor fish. In reality world, it is a tang, but it has a species. It's called the doctor fish. So the doctor is a portion of the team that you have, and that's grandma over here hanging out, trying to help out as well. So we can't forget about grandma. That's a very, very important portion of it. But we don't have that opportunity. We unfortunately are born with this whole world affecting us. There was a great study that was done in 2004, unfortunately, which showed how terrible our environmental pollution affects us. This showed chemicals, pollutants, toxins in the pesticides of umbilical cord kids. They studied 10 newborns, and they noted that 200 chemical pollutants, including PCBs, dioxins, and flame retardants, and mercury were in the umbilical cord. A total of 287 different toxins, carcinogenic, birth defects, very, very abnormal statistic, and it's shocking to parents when they find out how bad these are. Also, there was a study that was done with the nurses that showed that phthalate metabolites from plastics showed a big problem there. I'm going to pause for one quick second and bring this. 25% of the participants. And bisphenol A, which in my opinion is one of the major problems we have in this world. Chemicals come from plastics as well as from your receipts. When you go to a gas station or you go to a supermarket and they hand you a receipt, that shiny surface that you sign your name on, that has a coating of BPA, which is a hormone disruptor. And why do the 9-year-old girls have periods nowadays? It's not just the hormones in our cattle or our chickens, but absolutely it's the plastics that's caused a major problem. And we have 9,000 different chemicals released every single year, the trillions and trillions of pounds of chemicals that really screw us up. And unfortunately, mercury being one of the worst agents, the amount of mercury released every single year in manufacturing of coal combustion, 48 tons of mercury a year. This is a 2009 study. And if somehow or other the Environmental Working Group found 9 healthy individuals, I don't know how they found it in our planet anymore, and they had no exposure supposedly. But they found they had 167 different chemicals in them, and 76 of them being carcinogenic. And a lot of these have known toxicity to the brain. So why do we have such an abnormal development system where 1 out of 6 children have a developmental disorder in the United States? Now it's 1 out of 36 diagnosed with autism. Alzheimer's is rising. ALS is rising. There's got to be a correlation. Thomas Edison had one of my favorite quotes: "The doctors of the future will give no medicine, but interest his patients in the care of the human frame and the diet and the cause and prevention of disease." And that's what we try to unwind every single day. If our environment was as clean as possible, we would be in great shape. But we don't have clean waters like this anymore. There's a lot of pollution in our waters, and that's affecting our fish, which affects our health if we eat that fish. This is our world around us, unfortunately. Luckily not as bad as out here in Southeast Asia, where we have all this pollution in the water. These kids are swimming here. But we have the air pollution that's horrendous also around us. And we have the energy and the EMFs affecting us. We don't really know how all these things affect us. So let's look at the toxic soup that we're in. I love this slide I got from Bill Ray. This talks about the total body burden. So I use this as a bathtub of life. What have we accumulated inside our bathtub? What's dripping into us from these various sources? And is there a way of trying to reduce the faucet dripping into us of these natural and foodborne man-made toxins and outdoor toxins, ozone, lead, cadmium, mercury, pesticides. How can we slow this stuff going down into us? And is there a way of opening up the drain on the bottom part? That's what we use when we talk about an analogy of chelation, is to put a magnet in there to pull out some of the toxins that are inside your bathtub of life. Study came out showing that on average, for 1,000 pounds of each 1,000 pounds of environmentally released mercury in the environment of Texas, there was a 43% increase rate in special services and a 61% increase rate of autism. And you can see the areas where the chemicals were being produced and the rate of autism is so high correlating. So is there an association with the environment and autism? I think absolutely. We all say the genes load the gun and the environment pulls the trigger, and it really is a huge problem we have. If we look at the basics of autism, there's problems with communication, behavior, and socialization. And at the center of that is trying to find ways to make our major chemical the most important intracellular antioxidant called glutathione. I'm sure many of you know about this, but just as a review, problems with detoxification, oxidative stress, and inflammation can markedly reduce one's ability to make glutathione. If you have genetic predisposition for MTHFRs or other gene abnormalities, then your ability to make glutathione, and therefore these diseases become more of a problem. If you can't make glutathione well, you have problems with detoxification and oxidative stress. And when you look at these diseases that are listed here, every one of them have problems where the diseases will be improved upon if you can reduce inflammation, improve your detoxification, and improve your oxidative stress. And there are so many conditions here where hyperbaric oxygen therapy can markedly improve many of these conditions. But you have to worry about what chemicals are going in and how to pull them out of them. So if we look at what oxidative stress and inflammation does, we'll look at the unpaired electron that's occurring from the free radical. Free radical is an unpaired electron. And let's say you have a +2 charge and a -3 charge. Together they meet, and an extra electron gets careened off into the sidewall of a blood vessel. That's called a free radical. If it occurs in your brain, you end up with heart disease, potential for coronary artery disease. If you have it in your joints, you can get rheumatoid arthritis, and so on around the circle we go. But if you have problems with cataract formations from free radicals, so unpaired electrons, chemical stresses, and what causes a lot of these unpaired electrons are heavy metals that are volatile chemicals. We don't want various diseases here. In the brain, it's autism, it's Alzheimer's, it's stroke. So we want to try to find a way of how can we avoid some of these toxins. One of my mentors who just celebrated a wonderful Lifetime Achievement Award at the last MAPS conference is Sid Baker. And hopefully many of you know of Sid Baker, and he always talks about the thumbs up and the thumbs down rule. If it worked for my son, the thumb is up. If it didn't work for my son, the thumb goes down, and go from there. You always have to keep trying. But he always talks about his tax laws. And I know this is tax season ahead, so the tax laws are if you're sitting on one tack, it takes a lot of narcotics or resveratrol to make it feel good. Remember that the appropriate treatment for tack sitting is tack removal. And then if you're sitting on 2 tacks, removing one does not produce a 50% improvement. Chronic illness is or becomes multifactorial, and that's what we have to think about. So I threw the picture of the little tick-on ball there because there is a association now between Lyme-induced autism. And I know I'm adding a lot of different facts to you, and I'm going to try to pull it all together at the end. But I want to talk about Lyme disease. I want to talk about environmental pollution, and I want to find a way of shutting off both of those or controlling both of those. And then I want to talk about how to repair yourself. And hyperbarics is a great way of doing that once we get the body to heal. So that's not our first step. Our first step is to say, what the heck's going on with us? So I had a patient of mine, she showed me a picture of this, and she said, I found this on my son. What can I do? Well, you can see that we have a tick embedded, and he actually starting to have a ring around him. So we have to get the tick out properly. And then we have to figure out what kind of diseases we have to be concerned about. And in my opinion, and in many people's opinion, a tick can communicate its stomach contents in as little as 15 minutes. So if that tick was embedded in you for more than 15 minutes, you deserve an antibiotic. And then I know a lot of parents will go, well, I don't want to put antibiotics in my kid. My kid's gut's a mess to begin with. You don't want Lyme disease, and you don't want the Lyme-associated autism connection. So a lot of times kids are labeled as seizure disorder or ADD or ADHD, autism, and it actually is Lyme-induced autism. And we fix their Lyme and their autism gets better, or their ADHD gets better, or their seizure disorder gets better. And I have a number of patients where that's been very, very easily remedied by treating them for Lyme. If you catch it early enough, it's an easy remedy. If it's not, it's persistent Lyme, it becomes more of a problem. Both conditions have methylation and sulfation defects. Both of them are very sensitive to heavy metals and pesticides, and electromagnetic frequencies, GMOs. Every one of my patients, and hopefully everybody out there, knows about the environmentalworkinggroup.org. Please look at ewg.org, and we'll go into that a little bit more later. But that's a great site for safe issues and safe items you can put in your home, and what foods you should eat, and what needs to be organic or not. But both of the conditions can only dramatically improve once you rid the body of toxic metals, and if needed, increase hyperbaric therapies, which reduces the inflammatory messengers, the cytokines, they're called. Why is it so difficult to find this disease? Because the blood tests we have are terrible. And unfortunately, we do the tests that our insurance pays for, and a Western Lyme test from LabCorp or Quest usually is going to be negative. A positive test is good. A negative test doesn't give us all the information. And antibiotic production is greatly compromised in infected patients. So the tests are worthless. Sending out your tick, oh, I found this tick. My doctor told me to send it out to the lab. Oh, it didn't have Lyme. They can't test for everything that was on the tick. They usually send you back a report telling you what type of tick it is. So you want to think about what is possibly going on. Anything that's in the tick mouth can go underneath the skin. And I'm going to show you a list of all these terrible diseases that are associated with Lyme disease that are in the tick's mouth. Remember that Borrelia is a spirochete organism. That's the causative agent for Lyme. It can be sexually transmitted. It can cross the placenta, and it can be transferred in breast milk. And there have been kids who were born in the placenta with babesia, and there are kids who have been tested negative when they came out, and then they had breast milk, and then they were positive. Not only do you get Lyme disease, but you also get babesia and Bartonella and other critters associated with having this infection in your system. And then we have a problem with they put a little protective coating on it called a biofilm community, and that makes it even more difficult. But everybody thinks they can only get Lyme disease from ticks. Well, ticks are not the only critter that carries Lyme disease. Anything that can bite you can bite the animal that it fed on first and then bite you. So 22% of the mosquitoes in the state of New Jersey carry Lyme disease, which is a scary topic. So do mites and so do spiders, because they feed on the animal that transmits the tick. Everybody says, I don't have deer in my backyard. Well, the deer tick does not have to be attached to a deer. It can be attached to a mouse or a bird. So basically, any place a mouse can crawl or a bird can fly, you can get a tick-borne disease because a tick or a mosquito that fed on it bites you. This is a terrible slide that shows you chronic infections associated with autism spectrum disorder. Every one of these critters, these bacteria or fungi or parasites, can live in the mouth of a tick. I'm sorry to depress you. That's the real world. So please, I am a tickophobe. I do not like tick. You want natural insect spray, natural tick sprays, no DEET on your kids. The outline for how to improve our autistic children is just an outline. There is a whole series of puzzle pieces that you need to work through. You need to remove the dietary and environmental stressors. Be aware of the ticks. Be aware of the heavy metals. Bolster their nutrition. Treat for the chronic infections. Worry about pandas and PANS. Worry about Lyme-induced PANS. It's not just from strep. You can get Bartonella or Lyme-induced PANS, which is a neuropsychiatric disorder, which I'm sure you're going to have a couple of great talks on PANS and PANDAS. Reduce and relieve your inflammation. Improve your broken biochemistry. Learn about your methylation cycle, methyl B12, methylfolate. Improve your immune function. Detoxify, including chelation therapy, safely done, very safely done if it's done by a person who knows what they're doing. Hyperbaric oxygen therapy, great therapy. We'll talk about a lot down the road here. And don't forget about ABA therapy. So let's say you're in a position and you get to a certain advancement and you just can't get out of this advancement. You have to think about, okay, I'm stuck in a whirlpool. I need to go downstream. How do I get downstream? Well, doing the same thing over and over again until it works is not going to work until you add something new. So think about something new, or else you get stuck in whirlpools. We got to think outside the box. We want to think about what do we need to look at. So every one of my patients, and I don't treat anybody the same as anybody else, but every one of my patients will get a complete digestive stool analysis to look at their gut bugs and a hair analysis to look at their heavy metal exposure and their vitamin deficiencies. And these two tests are my cornerstone. There's blood work, there's other tests, there's OAT tests, there's a whole series of tests you can do, but these two are my bang for the buck. If I want to look at how well a person is doing, is to look at what's in their gut, because the gut controls the brain. Remember, your second brain is in your gut. Then when the gut is ready for it, I will do a urine chelation challenge for toxic metals. And then I will usually improve the things with the final step of improving the body and reduce inflammation and get the idling neurons in the brain to start to function again by using hyperbaric oxygen therapy. There was a great study that was done by Dan Rosenthal and others, Liz Mumper, etc., that showed that numerous studies to document the oxidative stress and inflammation in individuals with autism have shown improvement with hyperbaric oxygen therapy, along with enhancement of neurologic function and cognitive performance. And decreased inflammation measured at CRP, the word finding, the great results seen with these studies have led down the path where, hey, we need to think about using hyperbaric oxygen a little bit more. Don't have tunnel vision. Don't just think of one option at a time, which you want to. Add one supplement at a time. Watch the response. But take it to the next level. If that supplement didn't work in the past, go back to it once you fix the person and then go back to that treatment. We want to think about how bad our environment affects us. So heavy metal exposure leads to toxic buildup. And if you're pregnant and you get exposed to BPA, or you're pregnant and you get exposed to mercury or cadmium or lead or aluminum, you really want to think about what the problems are and where you get that. I'm going to leave the slide on for a second in case you want to take a picture of it, because it's a really good slide. And this is something that shows where the locations we get these various toxins from. Mercury, we know, is in some vaccines and dental amalgams and fish. High fructose corn syrup has mercury in it. So when you get anything that has high fructose corn syrup, which is really high fructose GMO corn syrup, because 90% of the corn in the United States is genetically modified, we don't want to be exposed to that with our kids. Forest fires is where the mercury vapor attaches to the leaves and then it gets re-put into the Earth's atmosphere, and it goes into the water system. Every one of the states have mercury in the water system. Lead is in the air. It's in the crystal. I hate telling people they use it to melt the chocolate in certain lead vats. Some of the poor quality chocolates do that. Pewter, naturally. Lead crystal. I mean, airplanes will fly over your head. They have lead in the fuel still for jet planes. So we can't avoid lead all the way. Aluminum, major neurotoxic agent found in Teflon-coated cookware, antacids, aluminum foil, cooking materials and processed cheeses. Definitely if you're a mom or dad and you're holding on to your autistic child or anybody, you should not be putting the aluminum underarm deodorant underneath you, because that's going to spread to your child. Remember, the autistic kid does not have a good barrier against environmental toxins. Cadmium is listed at where it is. Rubber mats, I've had patients work out on these thick rubber mats and they have so much cadmium inside of it. It comes from secondhand smoke. Arsenic is found in water and shellfish. So drinking water is allowed to have arsenic in it. Eggs and apples, even organic brown rice has arsenic in it. Basmati rice seems to have less arsenic in it. Almonds have a lot of arsenic in it. We want to think about how to look into our health. So again, the Environmental Working Group, the Dirty Dozen and Healthy Living apps you need to put on your phone, both Dirty Dozen and Healthy Living. And Healthy Living will talk about what skin products I can put on safely. The Dirty Dozen talks about what food products need to be organic or not. I always recommend at least the top 20 need to be organic on the Dirty Dozen. Antimony's in flame retardant clothing and gunpowder and house dust. And the last four, tin, titanium, nickel, and silver, they could be some fillers and poor quality vitamins will have titanium dioxide in it. Titanium dioxide is in some sunblock. You want to try to avoid these things because you may have a good time in getting rid of them out of your system, but your kids may not. So when I do a hair analysis on somebody, I'm going to look at, I want to see this line right here from the T in toxic down. I don't want that line to be crossed with having any of the abundance of heavy metals. This is a 4-year-old male who has a lot of aluminum and antimony exposures, etc. that's listed over here. On the good side, the hair elements, this talks about what's getting into the body. I like to see it in the green zone. And as far as you go this way, I'm sure you're not going to get toxic to too much magnesium because you'll have diarrhea if you have too much magnesium. So this is a reasonable item here. We might want to think about improving his manganese a little bit and work on these things. But this is remove the offending agents, which are all these ones listed over here going in. Remember, the hair analysis is like the faucet dripping into the body. So the bathtub of life needs to have a drain opened up on the bottom. That's when we give a chelator. But we want to shut the faucet off. Because remember, the first rule of toxicology is you need to shut the faucet off in order to try to remove the toxins that are in the system. Always avoid fish high in the food chain, especially with mercury, and definitely you do not want to swim with a great white shark. The scary part here is this slide. I got this from Boyd Haley. This is mercury escaping from an amalgam filling. The filling is 50 years old, and the tooth was extracted 15 years ago. So this tooth is lying around for 15 years, and there's mercury vapor coming off that tooth. So you can imagine if you have a mouthful of amalgams and you just breathe in, you're going to suck in all this lovely mercury vapor. Well, not a healthy item, especially when you look at the dental amalgam product label from the manufacturer. Remember, it's harmful if vapors are inhaled. Avoid breathing. So I think that's pretty funny that it tells you to avoid breathing when you have mercury in your mouth. Ingestion can cause neurotoxic, nephrotoxic effects. Inhalation can cause bronchiolitis, pneumonitis, etc. California proper warning: this product contains mercury, a chemical known to the state of California to cause birth defects or other reproductive harm. It's really crazy because the only safe place dentists can put this is in a human's mouth. They have to have a special filtration mechanism to prevent it from going into the environment because they know it's toxic to the environment. But it's okay if we put it in your mouth. So please make sure you have no mercury fillings in your mouth. So this is a terrible curve, and this is something that came out from a number of the studies in 2013, the chemical production rate versus the autism rate. And you can see the high correlation between one and the other. And unfortunately, I strongly feel the environment is a huge role in autism. And then when we have to deal with Roundup, which is glyphosate, this is even more challenging because we can't get rid of Roundup once it's in our soil. We want to think about avoiding genetically modified foods. So this will be the rate of autism in the various years plotted against the use of Roundup or glyphosate. And if anybody wants to learn more about glyphosate, please look up Stephanie Seneff, Seneff, out of MIT, and she's done a whole bunch of research on, credible research, on glyphosate and how it affects brain function in autism. So we found out we have these exposures to chemicals. How do we get rid of them? So we need to do what's called chelation therapy, and that means to grab onto and remove. As we know, environmental medicine shows us that it becomes more toxic more readily in kids that cannot have proper detox pathways. A lot of people have problems with autoimmune disease. There's so many inflammatory conditions. There's MTHFR, gene abnormalities, approximately 35 to 45% I've read. I've even seen as high as 55% of the population, depending on which study you read, shows that methylation pathways are not working properly because of the gene abnormalities. And I consider autism a heavy metal retention disorder because you don't have the capability of ridding toxins as readily because you have these problems in your detox pathways being clogged up. So chelation is done either topically, rectally, orally, or intravenously, which is the best way, to help bind toxins and prepare for proper excretion. You always want to make sure you have someone who is chelation certified, been trained on intravenous chelation therapy, if you're going to have him or her work on your child with intravenous chelation therapy. The oral chelators work fairly well. Rectal chelation fairly well. Topical is minimal. My analogy to what is chelation is what this sparrow is diving into the water for, is to grab onto a specific type of a fish, and the chelator is attracted to certain items one at a time or in small groups where it can pull out the toxins out of your system. I've been using chelation since 1994. I've been certified twice by the American Board of Chelation, the American College for the Academy of Medicine, the ACAM. I recommend anybody who's interested in learning about chelation, who has professional licensure, can go to ACAM, which is in November in Las Vegas, and learn about how to do chelation therapy properly. A lot of my patients who I take care of are cardiovascular patients. I'm a primary care doc, taking care of all ages from 2 to 102, and a lot of them have coronary artery disease or stents or problems with erectile dysfunction or diabetes, and we can actually improve their insulin requirements and the neuropathic pain by removing metals out. Multiple sclerosis becomes multiple sclerosis. You reduce the burden on the diseases when you get rid of some of the heavy metals on board. And we find out with Parkinson's as well. But many of my parents report great advances in their kids after each round of chelation is completed. It's like turning a light switch on with each round. And we have to think about, again, what are the different chelators? We have DMSA, we have calcium or disodium EDTA, we have DMPS, which is extremely potent, and sometimes a little toxic, so I'm very cautious with DMPS, especially in the kids. Vitamin C and alpha lipoic acid are chelators as well. The way to measure it is to do a chelation, to do a urine collection before chelating, and then you do a urine collection after chelating to measure the response to therapy. And then once we find if chelation works, then we might repeat it every 8 or 10 treatments, the post-chelation challenge, to see if we reduce the situation. We want to avoid heavy metals. This is in Vail, one of the slopes at the back there, and I saw that heavy metal sign. I said, I have to pose in front of that, because that's the anti-heavy metal. That's what I really believe in, trying to avoid that. So this is a 5-year-old who did a chelation challenge on October the 10th, October the 1st, and you can see before he chelated, he was not spilling much metal. In fact, if you look at his lead, he's spilling 1 microgram per deciliter. And then after the same day, when he had a chelator, he had 63 on his lead. His aluminum was 0, is now 130. So we know that chelation is a great magnet. It markedly increased the excretion of these products. When we did it again in March, the same child, we've seen reduction here from the previous numbers. On the lead, it was 63 before. Some of these other guys will shoot up and down a little bit. And then back here in September, you can see that he's got much improved from doing rounds of chelation, safe and effective. And it's like parents came up, it's like, he's lost a bad habit each time he comes in here. Not everybody's as dramatic as Joe, but it's a great therapy to see how the responses are. This one was a lead decrease from 22 to 7.8. This was done orally, actually, and it was actually DMSA, not DMPS. I don't know why it says DMPS on this, but this is a DMSA study that was done. But lead was used for this 10-year-old autistic child. When we try to talk about what can we do in synergy with each other, I love using hyperbarics and heavy metal detox combined. And if you look at the statistics from what used to be DAN, Defeat Autism Now, they had an Autism Research Institute poll that was occurring when parents would respond as to what therapy worked well for my child or not. And they had 12,000 parents' response. Every single year, chelation therapy was the #1 responding agent. Gluten-free, casein-free was about 65%, hyperbaric oxygen about 62%, melatonin about 62%, B12 62, 60%, chelation therapy 73 to 75%. Best rating from all the therapies offered in what was called the DAN protocol back then. Now we don't have a DAN protocol so much because it really is not a protocol. It's sort of a way of looking at it, and I tried to outline that for you. Now with MAPS, the Medical Academy of Pediatric Special Needs, has taken over DAN, and it's a great teaching area for physicians around the world and practitioners and even parents. But challenges for having a child sit for IV infusions have been the limiting factor for many. So now we have these ion cleansed foot baths, which have been quite helpful for many people by AMD. And it may be a way of enhancing heavy metal excretion via the kidneys. They tested the water. There's nothing in the water that's saying that we're moving metals out of the water, but when we did challenges of the urines afterwards, the kids are able to excrete more after having sessions in the iron cleanse. When you combine this with hyperbaric oxygen, you get some amazing results seen in many kids with inflammatory disorders. I'm also going to leave this slide up for a bit because this is the very important slide. Andrew Usman showed me many of these items for years, and I've added to over the years to this list. Remember, if you're going to use dry cleaning agents, please get a green dry cleaner. Always take the plastic bag off your clothes as soon as possible to let it off gas. I usually take the plastic bag off, let it sit in a room with a window open so I can get the chemicals off, because you don't want to trap the chemicals from your dry cleaning location in your home. You want to think about limiting your time in a hot tub or a swimming pool. Some people will go around with a Epsom salts and water spray and spray the kids down to get the chlorine off of their skin. We want to avoid fluoride in our toothpaste. We want to avoid fluoride treatments. We want to not build our raised garden for organic gardening with pressure-treated wood because it has arsenic in it. Use an air purifier in your bedroom. Don't use aluminum baking powder. Don't use aluminum deodorant. Do not cook in aluminum pots and pans. No Teflon coated cookware. Don't even let your food touch aluminum foil. Use parchment paper, unbleached parchment paper between your garlic bread or your lasagna tray and your aluminum foil, please. Minimize that. Avoid herbicides and pesticides. Use natural soaps and shampoos. And avoid recyclable numbers 3, 6, and 7. That's a little triangle on the bottom. 6 is going to be styrene or styrofoam. Number 7 is bisphenol A and antimony. And 3 is in that crinkly plastic that you have in Ziploc bags. So I always even wrap my sandwiches in unbleached parchment paper and then put it into the Ziploc bag. I try to avoid chemicals any way I can. We want to talk a little bit of time, and I want to leave some time for questions and answers if that's possible, and talk about my favorite safe therapy called hyperbaric oxygen therapy. If you look at this little graph on the top corner, this is the oxygen content in your hemoglobin, about 98% affected unless you're a smoker, and the plasma has a small amount of oxygen inside there. And if you look after hyperbaric, the volume or percentage of oxygen in the hemoglobin really doesn't change that much, but the percentage inside the plasma markedly changes. And that's the magic of hyperbaric oxygen. Because under increased pressure, you're allowing for more dissolved bubbles of oxygen to be added to the liquid portion where the large red blood cells are getting it. So in our body, our hemoglobin without hyperbarics has most of the oxygen and a few little dots here. But the big red blood cells can't get into the little nooks and crannies as the liquid can. So the beauty of hyperbarics is that we take this extra amount of oxygen that's in the plasma and push it through into the tissues around us. Remember, the brain makes up 2% of the body weight, but uses 20% of the oxygen. And small increases of oxygen pressure markedly improve delivery to the peripheral tissues and the mitochondria. The mitochondria are our energy source for our cells, and that's how we get things to work in our Krebs cycle, etc. This is a chemistry slide basically showing that an increase in atmospheric pressure allows for more gas to be dissolved in any given liquid. So if you have this amount of gas dissolved, by putting more pressure in it, you can concentrate that gas into the liquid section. And that's really what's going on. So the effect of hyperbaric oxygen is due to the body's ability to supersaturate the blood plasma with oxygen. So we can think about where else do we have liquid compartments. So we have cerebral spinal fluid, we have joint fluid, where you can saturate the area with compressed oxygen as well as the plasma. Not only will this increased amount be available to the tissue, but it will cross into the blood-brain barrier and allowing it to reach into those areas as well. So Dan Rosenthal and a bunch of others, good docs here, did a really good study years ago. Children with autism who received hyperbaric therapy with room air, 24% oxygen, which is really 21% in the air right here. Multiply that by 1.3, it becomes a 24% oxygen effective amount. For 40-hour sessions, had significant improvements in overall functioning, receptive language, social interaction, eye contact, sensory and cognitive awareness compared to children who only received slightly pressurized air. They had to do a double-blind study by giving the kids a little bit of pressure, so that was like 1.05 versus 1.3 atmospheres. But it was a conclusive study that showed that if you go in a hyperbaric chamber, like my friend Mike over here, who suffered with Lyme disease and suffered with Crohn's disease and suffered with Asperger's, he really became a Superman with the therapy that was involved. He actually rented this chamber in his bedroom and went in quite often to help resolve some of the issues. So some of the effects of hyperbaric oxygen we want to look at. When we look at an autistic child or adult, we know that they have decreased cerebral perfusion, increased oxidative stress, increased inflammation, increased inflammatory messengers, they're called cytokines. TNF-alpha and NF-kappa B are the names for them, and is considered a neurodegenerative disorder. But there are studies that prove that there's increased cerebral perfusion from hyperbaric oxygen, decreased oxidative stress, decreases the inflammation, decreases those inflammatory cytokines, and actually increases stem cell repair for neurologic tissue repair. So we can actually stimulate stem cell release by using hyperbaric oxygen therapy. A SPECT scan is a study that looks at the function of the brain. So I'm sure many people don't know how to read these, so I'll just tell you that if the area is blue, there's not a lot of activity going on. So this section of the brain, not really active. It's not like an MRI or a CAT scan that shows anatomy. This shows function. So the function of the brain before hyperbaric oxygen, 10 treatments later, after hyperbaric oxygen. So you can see the sections that are really blue have lightened up. Some of the other sections light up red and yellow. That's really good activity of brain function. And this is a study that has been reproducible and showing that the areas of the brain get stimulated due to the use of hyperbaric oxygen. It stimulates cell regeneration and improves neural brain function. Another study was done showing that these were 9 kids who had chemical exposure to a variety of solvents, chemicals, and pesticides, and the temporal lobes before and after, the center of the brain before and after, and other sections of the brain, again, the temporal lobes, before and after hyperbarics, showed marked improvement in the topic. I've had patients with various other injuries that we've used hyperbarics for. I had a spinal cord tumor patient. She had 8-year history of spinal cord tumor, where it was removed from the C5, that's in the base of the neck, to T2, and she needed 1 or 2 quad canes every single day. She was unable to shower without excruciating pain, felt like needles going into her. She had multiple narcotics. She had hyperbaric as a last option for her. She found me on the internet. It's like, do you know anything about hyperbaric and traumatic spinal cord injuries? I said, no, I've never tried it before, but it couldn't hurt you. So let's see if this can help you. So when she came out of her 4th treatment, she screamed at the top of her lungs as she walked down the hallway. This was the first time in 8 years I haven't used a cane, and she walked down the hallway. And that was so dramatic. And she continued on. It was just fabulous. So it can displace toxins. People may know of clostridial infections. Those are anaerobic infections. They don't like oxygen. So hyperbaric actually helps in killing certain bacteria and funguses and viruses. And actually, cancers have a center of it where there's poor oxygen. And oxygenation of the center of the tumor can actually slow down cancer growth in some patients. Inside the colon, when you do a colonoscopy on people, we want to see a nice smooth colon. In the autistic kids, we have ulcers. We have this condition called lymphonodular hyperplasia, where the lymph nodes swell up. No wonder our kids are screaming in pain or bending over or lying on furniture, because we have problems with inflammatory bowel changes. Well, hyperbaric oxygen also helps reduce some of the swelling in the gut. There was a study that was done with this one patient who was about to lose his his large intestine because he had a major ulceration of a Crohn's disease ulcer, and he was rectal bleeding. He was not able to maintain any weight. They did sessions in the hyperbaric chamber. I believe there were 20 sessions that were done. You can see the ulceration is markedly healed after having these procedures done. So what have we shown in various people? There are a lot of off-label indications. I'm always talking for off-label indications. Just to let you know, there are 13 Medicare-approved reasons that they will pay for hyperbaric oxygen therapy. The ones we're talking about here, they're not paying for it, unfortunately. And in fact, they also pay for it in a hospital setting only, and they pay up to $1,200 a session if you have, a dive-related injury or carbon monoxide poisoning. But that's not what we're talking about here. We're talking about for autism, or ADD, ADHD, PDD, or Asperger's. I use it for Parkinson's and multiple sclerosis, scleroderma, some of the autoimmune diseases. We've had it for Crohn's colitis and irritable bowel disease, chronic yeast infections. Lyme disease works very well with for immune dysfunction. We've had patients who've had strokes, people who had surgery, post-op memory loss, to find great results with hyperbaric oxygen, traumatic brain injury and migraines. There's a big study in the football leagues for cerebral injuries, CTE. Joe Namath is doing a lot of work with that down in Florida, trying to reduce some of the contact sport traumatic brain injuries from football using hyperbaric oxygen. We've had patients who've had casts on their arms or legs that have been able to get out of the cast 40% faster when we use hyperbaric oxygen. Myasthenia gravis, cerebral palsy. I have a kid with Duchenne's muscular dystrophy, which is showing improved cardiopulmonary measurements in the first therapy in 187 years to show improvement of a condition called DMD, the Duchenne's muscular dystrophy. Most kids are in a wheelchair by their 7th birthday and attached to a ventilator by their 15th birthday and pass away before their 20th or 25th birthday. And we're showing that this is slowing down in some of the cases that are out there. I have a opportunity I learned from Paul Harch about Eden Carlson, who was underneath the water for 15 minutes, submerged, 2-year-old, and they did 100 minutes of CPR and 17 cardioversions and epinephrines and tried to bring her back alive. They brought her back alive. Her brain function was minimal at best. They started hyperbaric oxygen after hospitalization, and the kid did phenomenal. As I was mentioning, we have a Jar of Hope is the name of the organization. If anybody wants to donate towards the Jar of Hope to see if they can improve money towards Duchenne's muscular dystrophy, their ongoing study, the data is not finalized yet, but they're showing improvement in muscle tone and pulmonary function, at least in the preliminary results, in the hyperbaric oxygen versus the placebo group. That's Jamesy, my patient. He's done fabulous. He's 9 years old now. He is not in a wheelchair yet. He's doing a great job at every single day going in a hyperbaric chamber, or every other day going in the hyperbaric chamber. Another case where Lyme disease, this is Chris, is a patient of mine. And again, I don't want to read the entire thing here, but when we deal with Lyme disease, most docs know nothing about Lyme disease, and they get misdiagnosed by it. I'm a Lyme literate medical doctor, and when he got to come into my office, we tried to unravel his Lyme disease. We detoxed him with some chelation therapy. We use hyperbaric oxygen. And if you read through here, you can say it's been a long battle. I feel it's almost over. I was barely able to walk up the steps, not able to focus enough to determine where that doorknob was, to leave the room, being frustrated and angry all the time, body aching. Now I can run around. My strength is almost back. I've been great for 7 months. He's actually been great for 2 years now. And the hyperbaric oxygen and chelation and nutritional support really helped for him. And he's been an advocate for hyperbaric oxygen. So you improve the circulation, wounds will diminish. We have stroke and Parkinson's patients getting greater strength. Mogul skiers, if you go snow skiing and your knees are killing you and you want the weekend warrior to improve, hyperbarics is a great way of helping that out. Again, we have usually recommended 4 to 5 times a week for 40 treatments at least. But in autism and ADD and ADHD, you need to see a lot more treatments sometimes. Fracture repair, vascular neuropathies, interstitial cystitis. Nobody really improves from interstitial cystitis from any of the drugs that are out there. This has been a very good therapy in my practice. One of my coworkers had a twisting fall on a stairway. He had a fractured of his 3rd metacarpal, and he was told he'd be in a cast for 5 to 6 weeks, and he borrowed a chamber for his house. He actually did it longer than I recommend for other people. He actually slept in a chamber for a night or two. And then after 2 weeks, the orthopedist was amazed because the fracture was completely resolved. He says, I can't take the cast off in 2 weeks. let's just keep it on for an extra week. And then he took the cast off after 3 weeks. Initially, he said he needed 6 weeks of physical therapy. He says, that's just, don't hurt your hand and just do some exercises at home. You'll be fine. Personal story for myself. I was involved with a ski injury in January 2013. I tore my medial meniscus. And naturally, as a stubborn doctor, I thought that it wasn't that bad, and I waited 3 months naturally to take care of it. But after I had surgery on a Friday, I went post-op into my car, and then someone drove me home. And then I have a hyperbaric chamber in my house, and I went in 26 hours over a 6-day period, a couple times a day. You should always have a 4-hour break between sessions. Then I worked in my office. I'm an osteopath. I do spinal adjustments. I'm up and I'm moving around. I worked 10-hour days Monday, Tuesday, and Wednesday, and then on Thursday I went to his office and I said, I'm really feeling pretty good. He says, I can't believe you have no reduction of your range of motion except for maybe 5%, and you have 5% of the swelling I'd expect. What did you do? I said, I did hyperbaric oxygen. He says, that doesn't work. I said, what did you do? I said, I did hyperbaric oxygen. He says, that doesn't work. But whatever you're doing is doing great, and I've never seen anybody recover this fast. And instead of you needing physical therapy, because I'm standing there, I'm hopping on my bad knee. He says, what are you doing? I said, I feel pretty good. He says, don't water ski for 3 weeks. So I was very impressed with the results, as was he. He actually now sends me some patients. Many professionals own a chamber. So there's a list of some of the football stars. And there's Brett Favre, who said the chamber was a big help. He signed it on his ball. And there's a list of other professional sport players who've used hyperbarics with some improvements. But I really want to close up with understanding there's a lot to be done, and I gave you a lot of information, and it's very difficult to perceive all the things you can do. You want to think about using your hyperbarics. Make sure you do a 4-hour break between sessions. If you consider another type of detoxification, the ion cleanse by AMD is a very good way of doing things. If you call up the company, you can ask some questions about that topic here. But it's been very helpful using the doctor's office. They've actually did a study recently with glyphosate. The study is not finalized, but up to 52% improvement of glyphosate excretion has been noted from the person's urine. So in closing, whether you're above the trees or taking the plunge below around the world, don't let the environment bite you in the butt. Fix your terrain. Do whatever you can. Find yourself a doctor who can think outside the box. And I will be happy to answer any questions we have now. If you get a chance, look at my website and check out some of these great videos I have. This is Calvin. His son is a Taka mom. His mother is a son of a Taka mom. And the quote on his video is, I thought my son was going to be institutionalized, and they told me that he was going to be institutionalized, but by all means, the only institution he's going to go to is Rutgers. And Calvin is doing phenomenal. So thank you so very much, and I'd be happy to answer any questions you have for me.
Yeah, that was wonderful. I think there was a lot of information, and I think that with autism, as you said, it's multiple pieces of the puzzle, as you demonstrated so well in your tie. Some questions that come to mind, and I can imagine others might think this. You talked a lot about hyperbaric, the soft hyperbaric chamber. How easy is it to get some of our kiddos with autism in that? I mean, I'm just thinking of my own son. Obviously, we've done hyperbarics as well, but it wasn't easy the first time. What's your thoughts on that, since you've dealt with thousands and thousands of patients?
Well, the first time the child goes in the hyperbaric chamber, he does not want to go in the hyperbaric chamber because it's a big thing. It's loud. You turn the noise on and you hear that rumble in the background. You have to occupy your son or your daughter with something. So in the soft chambers, you can easily bring in your DVD player. You know how kids are magnetic upon iPhones and cell phones and DVD players, as well as iPads. So as long as you keep them occupied and you have the mom or dad go in the chamber with the child, usually it's not a big event here. They go in, we have them test the waters, usually without any of the noises on there, and then he goes in with the mom. We'll zip them up and then turn the air compressor on. Usually they do really well the first time. When they come out, they might cry a little bit, but that's actually good because it opens up your ear canals as the pressure drops down. The next time they come in, while the mom is changing into her white scrubs, and we always give white scrubs to our patients, so I don't want dirty clothes to go in my chamber. I don't want to push any chemicals into the kids or into the skin, so I always want a clean chamber. By the time mom is changing into a gown, the kid is in there because he knows that the spaceship is where he heals better. And he feels better, or she feels better, by going in the chamber. So the kid is usually in there faster than the mom for the second or third or fourth or fifth time because they feel better. Not every child feels better the first 2 or 3 times, but usually that's the situation. In fact, some parents will say, wow, he was a little more hyper the first 6, 7 times. And now on treatment number 18, the light went off in my mind that he is going so well. And by time 25, he's phenomenal. Everybody's different. Some kids do a little worse after the 5th or 6th one as far as being rambunctious. But I'm telling you, they love it, especially if you occupy them with something when they go inside.
Now, what about the ears? I know for my son, because the ears kind of it's like an airplane kind of. We did some different things. We brought a cup that had like the kind of crazy straw to get him to kind of drink out of straws. We even did like the blowers. You would think at like at a party, people have the blower, anything to try to get him to kind of either blow or suck, because he didn't really understand how to pop his ears as we would, right? Sure. Similar to an airplane. He did the same things in an airplane. Do you recommend that? Do you recommend other strategies as well?
So first of all, it depends on how well your hyperbaric chamber operator is, because there's communication with the parent and you can see the reaction. You can crank it down all the way tight and the pressure will go up pretty fast, or especially in the kids in the beginning, you want to do it really slow. So where an adult who can clear their ears on command, you might get up to pressure in 7 minutes or 6 minutes, let's say. For a child going in the chamber, you were going to probably put it up to maybe taking 15 minutes to get up to pressure. So it takes a more gradual effect. So absolutely, you don't crank down the valve all the way, and you ease into it. So you can watch the gauge go up to 4.2 psi, which is 1.3 atmospheres. What I like is ear planes, Planes. You can get them in CVS. As long as the mother or the father is making sure they're not going to take this little device, which is like an earplug, but it actually helps equilibrate easier. It's also good for airplane travel, but it'll allow your body your ear canals to equilibrate to changes in atmospheric pressure at a greater ease. So my concern is if you have a child in there without a parent, he might take it and put it in his mouth and swallow it. That you don't want to do. So you want the parent to make sure that the kid's ear planes stay in his ears.
Now, you talked about having an in-home unit, right? I know that hyperbaric oxygen, they have rental. I know the system that you're showing, Oxidative, I know they have rental for at the home, right?
Correct.
It's easy. I know for me, I remember being really, really nervous. I thought, oh my goodness gracious, this thing's coming to my house. I have no idea. I've seen it at the conferences, but I don't really understand. I'm now going to have to go in this chamber with my child, zip it up, and figure all this out. Is it easy to set up? Obviously, I know after I went through it, I was like, okay, I was scared for nothing. But, to a lot of families out there, it's something new. Many of us didn't grow up knowing even what hyperbaric oxygen was, let alone having this kind of foreign object in our home. So is it easy to set up, and how do we keep them?
It really is easy. If a person is going to rent a chamber that I'm recommending, he's coming to my office, or he or she's coming to my office for a number of sessions to make sure they feel comfortable in doing it by going into my office and lying in the chamber, zipping their kid in, zipping themselves in, making sure they know how to do it in the office. Then they get it delivered to their house. There's usually a video associated with it that they can send to how to set it up. If it's local to my practice, I have one of my technicians who will usually run my chambers when I'm in the office. We'll go to the house and set it up and tighten up all the different Allen wrench keys that hold the cage together. It's really pretty easy to put together and take apart, but there are step-by-step instructions that can be done. It's really pretty easy. They ship it to your house. They actually have a rent-to-buy program, so you can rent it for your house for a month or 2 or 3. And if you like it, the money you put towards the rental, they'll apply it to the purchase of a new unit. So there's a really good program they have. It's a company that I would stand behind. I would not get any chambers online. I would not get it from any other unreputable dealerships. I trust OxyHealth wholeheartedly in their quality of manufacture and their warranties on their products. There are some less than ideal companies out there, and you can go on the internet and you can get cheaper chambers. I don't want cheaper chambers. Definitely do not want the conical chamber that looks like a little cone. That has some problems. We don't want the zippers to break. We want to have a good quality chamber. So I would recommend OxyHealth wholeheartedly.
Now, does the parent that goes in the chamber with the child also benefit from being in the chamber?
Absolutely. So we're improving brain function. I mentioned before it helps with the weekend warrior. It helps with Parkinson's and multiple sclerosis and stroke and circulations. I've had parents go in the chamber and they're like, my friends thought I had a facelift because my wrinkles got better, And I had, for ADD and ADHD and concentration. Today I had a psychologist who came into my office and we were talking about his hypertension, etc. And he has ADHD. And I said to him, so how you been doing? He says, I love that hyperbaric chamber. I focus so much better when I go in the chamber. I've actually had a minister who came in every Friday so he can write his sermon for Sunday by going in the chamber and having his thought process improved and more clarity. So without a doubt, it's phenomenal. It's great therapy. I haven't seen any negatives. If you have a recent chest tube, that's a contraindication. If you have a history of emphysema, that's a contraindication. If you have a history in the past that your lungs spontaneously collapsed on you, you could not go in the hyperbaric chamber. And you should not go in the hyperbaric chamber if you have an acute sinus infection. Outside of that, for the most part, anybody is a good candidate for hyperbaric therapy.
And that was going to be my next question. And so now, lastly, what came to mind was you were talking a little bit about the ion cleanse foot bath by AMD. Do you see any results in your practice by using that with the hyperbaric, or do you suggest doing one versus the other, or what's your recommendation?
Like I said before, you can't just do one thing. You have to not get stuck in a whirlpool saying, I'm just doing this one therapy. So I like as a tool, I've had parents had their children get involved with the Ion Cleanse by AMD and had some very good results, again, on focus and on speech, but not everybody responds to every therapy. I think chelation is the number one responding therapy, and if your kid cannot sit for an IV, because of the age and the fidgetiness, or you're nervous about intravenous chelation therapy, topical doesn't really work. Oral messes up the gut a little bit, so the Ion Cleanse by AMD is a good therapy that you should consider. I think IV chelation is by far superior to any other therapy for detoxification that's out there. People might even say in the back of their mind, but I heard chelation therapy killed 2 kids, and the answer is yeah. Chelation therapy did kill 2 kids because the doctor did not have the right ingredients in both of those situations. So if you're going to go to a chelation therapy doctor, he should be certified in chelation therapy. There is a total difference between the adult chelation and child's chelation, and unfortunately what was done with these 2 deaths was that the adult type of chelator, a sodium EDTA, was pushed into a kid which was calcium EDTA, what he should have had, and that caused the terrible events that occurred both in the Midwest from using the wrong drug. If I gave a patient the wrong medication and it had a very bad side effect, it's blamed on the doctor who gave that terrible drug. Mm-hmm. Well, that's exactly what happened. It wasn't the chelation therapy caused the damage, it was the wrong drug was used, but it was during a process of chelation that got the bad label. So chelation, if it's done safely, if it's done by someone who's chelation certified, is very safe and effective. I do like the AMD device. I have seen some good results. Again, nothing across the board on any of the therapies. So the idea is to try one, try another, augment it with this, make sure you're taking your probiotics, make sure you're doing all the different things to get the gut working. Avoid the pesticides, avoid the GMOs, avoid the chemicals, the heavy metals. Shut the faucet off, open the drain up, pull the crap out of you, reduce the inflammation, you heal brains.
And is that something that you have to do ongoing as you're talking? Came to my mind. Is this something, like, let's say you try the IV chelation and you do the hyperbaric and the ion cleanse. Is this something, if you're starting to see results, that you need to do ongoing for your child's life?
You actually revisit the topic. So let's say I'm doing 80 sessions of hyperbaric oxygen therapy and I got to a certain level and I'm really good. Well, let's stop for a while. let's try to do something else. So we'll do another therapy, and he lost some of the effects of hyperbaric. Can we do it like 2 or 3 times? Can we come into your office for 2 or 3 times rather than renting it for another 40 days or 40 treatments? Sure. And then you really get back to that level pretty quickly if you've been exposed to the therapies in the past. When you're chelating and you get your metals down to a certain point and okay, let's slow it down. And then after 4 months or so, you chelate again. The metals are back because the deeper tissues are now releasing it, and now it can be more attainable to the chelator. So it all depends on what we're talking about. Can you continue with using the AMD cleanse 3 days on, 1 day off, 3 days on, 1 day off? Sure, you can. Are you going to see benefits continuously? No. So the idea is you want to try to do your therapy that's working, that shows the thumbs going up. Continue with that therapy. When the therapy doesn't give you that continual growth, switch to a different therapy. But come back to that therapy that you had a good improvement from. And even if you had a bad response in the past, and you then did step B and step C and step D, go back to step A, because maybe you'll have a thumbs up from that one. That's why it's called a puzzle.
That's great advice. Now, we talked about so much. I think that your lecture was just really amazing. I know so many people, in our world, I've seen you for years, Dr. Dornfeld. This is something we talked about for many years, and it continues to evolve. However, for that brand new parent out there, what can we leave them with that message of, this is a lot of stuff for them, especially maybe they just got the diagnosis of autism. They've never heard of any of this before. What can we leave them with that message of hope, I guess?
That's the word.
Mm-hmm.
Hope. I had a kid come today with his 2-year-old brother. He's 4 years old now. I met them a year ago. So they were 1 and 3. This kid had seen all the gurus in autism world. I'm not going to mention names, but all the really great doctors. He was on 6-MP. He was on steroids. He had really terrible bowel disease. He had no speech. He's 5-6 times violent pooping all day long, violent behavior, really a bad shaped kid. I saw him at a taco conference, I saw the parents at a taco conference, and we were talking over lunch, and I ended up taking him as patients, and they were on my waiting list for a bit to come in, and I took them as patients. And today she came in after a year of getting off all those meds, putting her on the program that I outlined here with nutritional support, with hyperbaric oxygen, with detoxification. She's done a little bit of the ion cleanse. She's done a lot of things to get the bowel ready. And last weekend at the MAPS conference, he wrote down Dr. Dave on a piece of paper so that I know that he was saying something to me. I was almost in tears that he actually said that. Today I walked into the room and he goes, "Hi, Dr. Dave," like out of the blue.
Aww.
There's hope for everybody.
It doesn't matter the age, right? So that's something that's different. What about somebody's watching right now and they've tried everything, it feels like, and their child's 16, 17, 22. What kind of message can we leave them with?
I have a 17-year-old patient who has seizures. He has seizures 5, 6, 7 times a day. His mom happens to be an EEG tech, and the son is nonverbal, has seizures. I met him the first time. He comes into the room. He gives me a big hug, kisses both cheeks. He's the sweetest little boy in the world. Alec is trapped in a body he cannot speak. He is having seizures multiple times of the day. I do the appropriate testing. I find out, I said to Mom, it sounds like he may have Lyme-induced autism and seizures. Oh, he's been tested, he's been tested, he's been tested. Well, we fixed his gut a little bit. He started having seizures from having probiotics. We give him vitamin D, and he's having seizures from vitamin D. We did a Lyme test on him, which showed that he had chronic persistent Lyme inside of him from a different lab that was not Quest or LabCorp. And I treated him for the tick-borne disease, and lo and behold, his seizures are starting to go down. He now has to be treated for SIBO. His seizures are getting better because we're treating him for SIBO. He's going to start speaking pretty soon. He's 17 years old.
Aww.
And she has been racking her brains to the point of getting divorced, like most of the parents do when they don't get a teenager approved. Mom still wants to do this, Dad wants to do this, and they break up. And it's a grueling story, but Alec is going to come in next week here, and he's minimized his seizures to, like, now he hasn't had one for about 4 or 5 days.
Wow.
That's the first time. That's really cool. And CBD oil, another great thing to think about for these kids.
Oh my goodness, that just made my heart so happy to hear that story.
There are ways of improving kids who are later in the spectrum as well as those early in the spectrum. The earlier, the better. You get them before puberty, you get them fixed before puberty, life is better. But, you know, you have the 20-year-olds and the 18-year-olds. They're really hard. And some girls are really hard to work with. But the idea is keep trying one thing. If it didn't work, go to the next thing, go to the next thing, but come back to the first thing, because you might find that initial therapy is going to work much better once you cleared up the other items.
Well, gosh, thank you so much, Dr. Dornfeld, for taking the time. Definitely thumbs up for me on this presentation. And for all of you guys watching, you know, there's so much hope. We don't want to give up. Doesn't matter the age. And I feel like we're learning more and more and more as the years go on. And I feel like doctors like you are figuring out more ways to help parents like myself. So.
We try hard. It's so rewarding. I mean, I was basically in tears today when he said, "Hi, Dr. Dave." He's like, "You made my day." Little Austin is a great little kid.
Thank you so much, Dr. Dornfeld, and for taking the time. And thank you all for watching. Until next time. Bye, guys.